Yes, can audible? Can I audible? Abhishek? Okay. So starting with today's lecture, in today's lecture we are going to discuss the topic that is the chief complaint and the auxiliary symptoms in their relation to the case, that is explained by H. Robert in his philosophy. So in this chapter they explain about the different types of symptoms. Mainly what is the importance of chief complaint, what is the importance of auxiliary symptoms, or what is the importance of alternating symptoms, concomitant symptoms. In this topic they explain about the different types of symptoms, and in this mainly the importance of chief complaint and the auxiliary symptoms, that is why patient comes to us with the chief complaint, and we have to find out the auxiliary symptoms for the selection of remedy. So in this regard, Dr. H. Robert explained about what is the chief complaint and the auxiliary symptoms in their relation to the case. What is the importance of these symptoms in the case while we are taking the case or we are treating the patient. So in this we will see what Dr. H. Robert explained about these different symptoms. So starting with topic, almost every case that comes to the attention of the physician presents two distinct phases, two separate parts, as it were, the part comprising the symptoms of which the patient complains, those which are most annoying to him and the most outstanding in his recognition, and secondly, those symptoms which he does not recognize as symptoms or which he does not consider worth reporting or does not consider as having any relationship to the case. So in this they explain about what is mean by chief complaint and what is mean by auxiliary symptoms, as patient comes to the physician for two reasons, or in this almost every case that comes to the attention of the physician presents two distinct phases, that is when patient comes to us we have two distinct phases in this, one phase and the second phase. One phase is that the patient who is come to us for his present complaint, that is patient coming to us with some complaints, and in this is the first regard, and second regard is that the patient who is unaware of his symptoms but we have more interest in that symptoms, as these are the important symptoms for the individualization of that patient or for the selection of remedy. So these are the two different phases that seek the attention of the physician for the patient. You understand, the first phase is that is the patient comes to us with a present complaints, that we call it as a chief complaint, and this is the most important annoying part of the patient and most outstanding in his recognition, that is patient gives importance to his chief complaint. And the second part is that the patient is does not recognize his symptoms on which he does not consider worth reporting and does not consider having any relationship to the case, but the physician having more interest in that auxiliary symptom, as this having the importance for the individualization of that patient or for the selection of remedy. So these are the two parts that is explained in this first paragraph regarding the chief complaint and the auxiliary symptom. Then what is given in second, that is The chief complaint has a psychological value out of all proportion of its value in homeopathic prescribing. It brings the patient to the physician, and if the physician responds and by careful questioning draws out the history of other symptoms, the patient feels a satisfaction and confidence that the physician is not treating his case as of no consequences. So when patient comes to a physician, it is mainly for the chief complaint. He want to remove or he want to cure that chief complaint. So that chief complaint having a psychological value out of the proportion of its value in homeopathic prescribing. As we know that we cannot prescribe the medicine only on a chief complaint, so it is a less valuable in homeopathic prescribing, but along with this chief complaint having a psychological value, as patient gives more importance to the chief complaint. So in this, it brings the patient to the physician, and if the physician respond and by careful questioning and draws out his history of other symptoms, that is, when physician asks about the chief complaint to the patient, then patient feels satisfaction as physician will treat my chief complaint. And if physician do not ask about the present chief complaint, then he may think that the patient physician not doing anything for my chief complaint. So it is having a psychological value, and we have to give importance to the chief complaint also while we are narrating the symptom of a patient, or while we are giving the while we are taking the case from the patient as having a psychological value. So this is explained in this second para. Then in third para, Dr. H. Robert explained about now the chief complaint is very necessary part of every case. Some of our colleges are giving the chief complaint of every case much consideration. The young physician places much dependence upon this part of the case. It is close to his training along diagnostic lines. The older prescriber, while giving due weight to the chief symptoms, feels that in prescribing he must consider the totality of the symptoms, and in order to do, he must give more weight to the other part, probably unexpressed, without some encouragement on the part of the physician, which is an even more necessary part of the case than the chief complaint, because it is the part which manifests more clearly the individuality of the patient and indicates most clearly the individuality of the remedy to cover the case, the totality of the symptoms, if you prefer. So in this para, it is explained that is regarding the young physician and the old physician. As you are a student, you give importance to the chief complaint. As you are studying the homeopathy, or you are getting the training of how to practice the homeopathy. So in the prior period of your training, you give the importance to the chief complaint. And in colleges also, for the diagnostic purpose, how to diagnose the case, you give the importance to the chief complaint. So the young physician more dependent upon the chief complaint, as he can easily narrate the chief complaint and give the remedy according to that chief complaint. But when the physician is old, or when the physician is very well experienced, then he neglect that chief complaint and he give the importance to the auxiliary symptoms. That patient don't think any importance to that auxiliary symptom, but these are the important symptoms according to the physician, as it will individualize the case, it will individualize the patient, and it give the proper selection of remedy. So in this para it is explained that is young physician give the importance to the chief complaint, and the old physician give importance to the totality of symptoms or the auxiliary symptoms also. So this is regarding the young physician and the old physician. Now in next para, what Dr. H. Robert explained, that is, the chief complaint as presented by the patient may be altogether different in value from the symptoms discovered and eliminated by the physician's analysis of the case. The chief complaint is often a pathological state or an approach toward a pathological state in a fundamental sphere. That is, chief complaint are related to the pathological condition that is explained in this para. That is, the chief complaint as presented by the patient may be altogether different in value from the symptoms discovered and eliminated by the physician's analysis of the case. The chief complaint is often a pathological state. What is the pathological state present in that patient? It will give his chief complaint, an approach toward a pathological state in the functional sphere. So in this, the chief complaint or the leading symptoms may be defined as those symptoms for which there is a clear pathological foundation, or the symptoms that are most prominent and clearly recognizable, or the symptoms which first attract the attention of the patient or physician, or which cause the most suffering, or the which indicate definitely the seat and the nature of a morbid process which forms the wrap of the fabric as it has been expressed. So in this para they explain the definition of chief complaint. What symptoms you call it as a chief complaint? So this is explained in this, but prior to this, that is, the chief complaint is often a pathological state. This is the question that is asked in an exam for 2 marks, that is the what chief complaints indicate. So in this you have to answer, that is, the chief complaint indicates the pathological state of a patient. This is the 2 marks question that is asked by university in one exam, that is what chief complaints indicates. So chief complaints indicates the pathological state of a patient. Is it understand? Yes. Are you able to understand? मागे एकदा एक्झाम मध्ये विचारलं होतं त्यांनी, हा फिलॉसॉफी मधला क्वेश्चन 2 मार्क्स साठी एका पेपर मध्ये विचारलं होता की चीफ कंप्लेंट्स काय इंडिकेट करतात 2 मार्क्स साठी, तर त्याच्यामध्ये पॅथॉलॉजिकल स्टेट इंडिकेट करतात असं आन्सर होतं. ते लक्षात ठेवा जर रिपीट झाला परत तर. समझ में आ रहा है ना हेरा? Okay. So now in this next para, they explain about the definition of chief complaint. What is mean by chief complaint? So in this, the chief complaints are the leading symptoms, may be defined as those symptoms for which there is a clear pathological foundation. In this, what is the chief complaint? Having a clear pathological foundation, or the symptoms that are most prominent. These are the most prominent symptoms and clearly recognizable. That can be, we can recognize these symptoms very clearly, or the symptoms which first attract the attention of the patient and the physician. These are the main symptoms which attract the attention of the patient and the physician, or which cause the most suffering, or which indicate definitely the seat and the nature of a morbid process. That is, what is the morbid process in the body that can be give its seat and nature, then which forms the wrap of the fabric as it has been expressed. So this is the definition that is explained in this para of a chief complaint. So when you ask about the chief complaint according to H. Robert, so you have to define this definition, that is explained in this para. Then in next paragraph, what Dr. H. Robert explained, the auxiliary or concomitant symptoms or a group of symptoms seldom of any definite relationship to the leading symptoms from the standpoint of theoretical pathology. These are the symptoms which the pathologist would exclude an accidental and meaningless, but they have actually the definite relationship to the case because they occur in same patient and at the same time or in a definite relationship of the time as the other symptoms which are considered the chief complaint. If they do not fit into the theories of pathology, they have an even greater individual value in the case. Those symptoms which can be explained are of little help in selecting the homeopathic remedy, but it is this group of auxiliary or the concomitant symptoms which limit the choice of the simillimum. Now in this para they explain about the importance of concomitant symptoms or the auxiliary symptoms. As we know that auxiliary symptom or the concomitant symptoms don't having any pathological relationship to the body. So the pathologists consider that these symptoms don't having any value. But according to the homeopathy, these symptoms don't having a pathological value, but these are the important symptoms for the individuality of the patient, that is having an individual value, that is it is something different in that patient which indicate our homeopathic remedy. So this is important for the selection of a simillimum and not for the according to the pathologist or according to the allopath, as they want to diagnose the case on this pathological condition only, but this don't having the importance in a homeopathy, as we have to individualize that case. We have to think that how this patient is different from the other, and for this reason these symptoms having a importance according to the homeopathy but don't having any importance according to the pathologist. This is given in this para. Then in next para, that group of which the patient complains most, almost without exception, cannot be relied upon for the definite selection of the remedy. It is the concomitant group of symptoms which, taken in conjunction with the major group of symptoms, makes possible the definite selection of the remedy by greatly reducing the number of remedies indicated in such conditions. And upon a closer analysis, we can pick the simillimum undering from this small group. So in this, when we have a concomitant symptoms, these are important for the selection of remedy, or when we have a number of group of remedies coming to rule out that remedy, it is importance of a concomitant symptoms, as this helps to reduce the remedy count. As having a group of remedies, these concomitant symptoms important to reduce the remedy count, and we finally go to the 2 or 3 remedies, and from this we have to select the proper simillimum for that patient. Then next, for instance, when we find a case, now for this reason they explain the 2 examples in next para, that is, for instance, when we find a case where the patient gives as her chief complaint, that is ovarian pain, we cannot instantly. Yes, all of you break my voice or only Vijay? थोडा रेंजचा प्रॉब्लेम येत असेल, पण कळतंय ना काय बोलते ते. ओके ओके विजय, तू थोडं याच्यामध्ये रेंज मध्ये. आता त्यांनी काय सांगितलं की जे काही कॉन्कॅमिनेटिव्ह सिम्पटम्स आहेत किंवा ऑक्झिलरी सिम्पटम्स आहेत ते काय करतात की जे काही नंबर ऑफ ग्रुप ऑफ रेमेडी येतात आपण रेपटाईज केल्याच्या नंतर त्या ग्रुप ऑफ रेमेडीमध्ये रूल आउट करण्यासाठी रेमेडी की आपल्याला त्या प्रॉपर रेमेडी पर्यंत जाण्यासाठी याचा इम्पॉर्टन्स आहे. तर त्याच्यासाठी त्यांनी दोन एक्झाम्पल नेक्स्ट पॅरेग्राफमध्ये एक्सप्लेन केले. त्याच्यामध्ये फॉर इन्स्टन्स when we find a case where the patient gives as her chief complaint ovarian pain, we cannot instantly pick the remedy from a consideration of this symptom alone. The homeopathic materia medica has over 50 remedies that have this symptom. Then cerebral congestion may be made with any one of 150 or more remedies, and so with many single symptom pictures. We might cite numerous complaints where the chief complaint would lead us into many of remedies, any one of which might give relief to the patient, but only one of which would cure. So in this para, they give the example regarding this, that when we take one symptoms from a chief complaint, that is if ovarian pain, we take symptoms in that. For ovarian pain we have near about 50 remedies in materia medica, and when we take the example of cerebral congestion, in that we will get the 150 or more remedies for this chief complaint. So this is not proper selection of remedy, and for this reason we have to take the auxiliary symptoms, concomitant symptoms, to find out the or to reduce the group of remedies. Then in next para he explained about, that is, at times the chief complaint seems contradictory to the auxiliary group of symptoms brought out by the physician's questioning. The patient may have within the course of a day an exceedingly dry mouth and then complain of its excessive moisture. The patient may complain of diarrhea, but a careful taking of the case may reveal an alternation of diarrhea and constipation, or there may be a complete alteration of symptoms at different seasons of the year, as rheumatic conditions at one time and gastric disturbances at another time. So, rheumatic pains in the limbs during one attack and perhaps rheumatic arthritis at another time. The physician will find many such alternating symptoms group, any one of which may be the chief complaint. Only the thoughtful, thoughtless physician will tell the patient that the present symptoms is the one of the considered at present time, and when other symptoms group appear it will be plenty of time to consider that group. Such a attitude on the part of the physician may seem logical, but the thoughtful student of homeopathy realizes that many remedies in our materia medica have alternating group of symptoms, and he cannot ignore any symptom which the patient may recite. So in this next para they explain about the alternating symptoms, that is, the patient having at some time with one type of symptoms and at another time with another type of symptoms. So in this, these are the main chief complaint of the patient, but we have to see accordingly, that is how that chief complaints are occurring. At one time patient having a diarrhea, but at another time have a constipation, but at particular time when patient having a diarrhea and we indicate the medicine for diarrhea, it is a wrong thing, but we have to consider that diarrhea, and at another time patient having a constipation, so we have to consider this symptom as diarrhea alternates with constipation, and now this is a individual symptoms, or this is the alternating symptoms which may help in the indication of a remedy. So in this they gave the different examples of a rheumatic pain or the rheumatic arthritis, then diarrhea alternates with constipation, or the gastric complaints disturbances alternating with rheumatic disturbances. So these are the examples of alternating symptoms. So we have to give importance of this also, That is, if the physician is thoughtless, he will indicate the remedy only for diarrhea, he will indicate the remedy only for the constipation. But when you are the real student of homeopathy, or you are a thoughtful physician, at that time you may think that it may be a alternating symptoms, or you have to study properly, that is, this is the alternating symptoms and this is the main uh, individual symptoms which indicates the individuality of the patient, and you have to prescribe the medicine accordingly. So this is regarding the alternating symptoms explained in this para. Then in next para they explain about the keynote symptoms. That is, much has been said of keynote prescribing. Many at the present time use a repertory simply as a mean of seeking a key to unlock the case through the peculiar unusual symptom. This has a certain value if we are so fortunate as to find the simillimum by one outstanding peculiar symptom. But most often this is not enough, and it has little more value than selecting at random any one remedy from a group known to have certain symptoms in the provings. We must not fail to recognize the value of the totality of symptoms, and this must take into consideration the chief complaints, those of which the patient most often complains, plus the peculiar characteristic of the patient. If both these elements are present, we may be sure as we on a right track. Then after this they explain the few cases. So in this para they explain about the keynote symptoms, that is the keynote prescribing. And nowadays it is very famous of keynote prescribing, that is something or some peculiar symptom is taking and see in a repertory. So you have a number of group of remedies that is coming for that particular symptom, and you have to select the any randomly the remedy. And if you select in this way, this is a wrong method. Or if you are a very fortunate physician, many of the time you may be correct, but this is not the way to practice the homeopathy. So not only depending upon the keynote symptoms indicates the remedy, or it may help for the ruling out of a remedy and not for the selection of a remedy. That is, you do not select the remedy only on a one or two symptoms. To select the remedy, you must understand about the chief complaint, you must understand about the what are the peculiarities of the patient, and by combining this chief complaint and the peculiarities of the patient, you have to consider the totality of these symptoms, and you have to select a proper remedy on this totality of symptoms. So in this they explain, that is, we must not fail to recognize the value of totality of symptoms while selecting the remedy, and this is the right way to practice the homeopathy. Oh, this is the right track to practice the homeopathy, and only prescribing the medicine on a keynote symptoms, it is not the right way to practice the homeopathy. So this is regarding the keynote symptoms. So all of you understand up till now? Yes, all of you understand? The main theme of the chapter is regarding the chief complaint and the auxiliary symptoms. And in this, what Dr. H. Robert explained, I will revise it, as within 5 to 7 minutes the meeting will be end. So I will revise it, and what are the examples that are given by H. Robert we will discuss in the tomorrow's lecture. All of you understand? Now we will revise what we study in this topic, that is the chief complaint and the auxiliary symptoms. So in this, firstly we in first para we discuss about, that is when the uh, patient comes to a physician. When patient comes to physician, it having a two phases, that is two separate parts. In this first part regarding the patient complaints, that patient thinking that these are the most important or the most outstanding in his recognition, and secondly the symptoms which he does not recognize as the symptoms, or which he does not consider worth reporting and does not consider having any relationship to the case, but these are the important symptoms according to the physician for the selection of a remedy. Then in next para they explain about, that is the chief complaint having a psychological value, as it don't having any value for the selection of a remedy many of the times, but it having a psychological value as patient comes to us for this chief complaint. Then in next para they explain about, that is the chief complaint, what is the importance of chief complaint for the young physician and the old physician. As you know that, as you are a young physician, you totally depend upon the chief complaint, as they are easy to rule out, or they are easy to consider the case, or that are easy for the selection of a remedy. So young physician give importance to the chief complaint, but the old physician give importance to the totality of symptoms, or they give importance to the auxiliary symptoms, as these auxiliary symptoms individualize that patient, and these are important for the selection of homeopathic remedy. Then in next para they explain about, that is chief complaint is often a pathological state. What chief complaint indicate? It indicate the pathological state of a patient, that is the chief complaints. Then in next para they give the definition of chief complaint. What is the definition of chief complaint? As it is defined as those symptoms for which there is a clear pathological foundation, or the symptoms that are most prominent and can early recognizable, or the symptoms which first attract the attention of the patient or the physician, or which cause the most suffering to the patient, or which indicate definitely the seat and the nature of a morbid process. So this is the definition of chief complaint according to H. Robert. Then in next para they give the importance of auxiliary symptom or the concomitant symptoms. As you are a pathologist, you don't having any importance for the auxiliary symptom or concomitant symptoms from the pathological basis, but as a homeopath you must have a importance to these auxiliary or the concomitant symptoms, as these symptoms individualize the patient, as how it is different from the other patient, and for this reason these are important for the selection of the simillimum. Then in next para they explain about, that is what is the importance of these auxiliary or the concomitant symptoms, as these are important for the selection of the remedy by greatly reducing the number of remedies indicated in such conditions, and upon a closer analysis we can pick up the simillimum for this from this small group, that is this reduce the remedy count, that is when you have a symptoms that will give a group of remedies, and to reduce that group of remedies or reduce the count of that remedies, these symptoms are important, as it will individualize that patient from the other remedies. Then in next para they give the examples regarding the ovarian pain or the cerebral congestion, as when you put these symptoms in a repertory, you have near about more than 50 remedies for the ovarian pain, or near about more than 150 remedies for the cerebral congestion. So to find out the exact remedy, you must know about the auxiliary symptoms, or you must know about the concomitant symptoms of the patient that will reduce the count of the remedy. Then in next para they explain about the alternating symptoms. What is the importance of alternating symptoms? As you know that if the physician is not thoughtful, or if the physician is thoughtless, in that case he may consider that at one time patient is suffering from diarrhea, so he indicate the remedy for the diarrhea. If patient is suffering from constipation, he may indicate the remedy for constipation. But at this time, he may have that eyes to see the homeopathic difference between the selection of a remedy. That is, if the physician is thoughtful, or if he is a real student of homeopathy, he may think about the alternating symptoms. That is, at some time patient is suffering from diarrhea, at another time he is suffering from constipation. So these are the related to alternating symptoms, and this is the symptoms which will individualize the case, and he has to consider that symptoms and select the proper simillimum for this patient. And in next para they give the importance of keynote prescribing, or how keynote prescribing is danger, that is to select the medicine only on a keynote prescribing. So in this they explain that do not prescribe the medicine only on a keynote symptoms, as this may go wrong at many times, as we must not fail to recognize the value of totality of symptoms. That is, while selecting the remedy you must consider the totality of symptoms. In totality of symptoms you have to consider the what is the present chief complaint of the patient, along with this what are the different peculiarities of the patient, and you have to select the proper medicine on this totality of symptoms. Then and then only you are on a right track, otherwise you will get failed. So this is regarding the keynote prescribing, that is explained by Dr. H. Robert in this chapter, that is the chief complaint and the auxiliary symptoms. Now the half topic is covered. In next or in tomorrow's lecture we will take the remaining part of the topic, and if time permits we will took another topic. So I think all of you understand about this topic. If anyone having any difficulty, you can ask me anytime. So we will stop here. Thank you friends.